hello and welcome. And thank you for joining us for our webinar today on the state of pet inclusive social service delivery, a national snapshot of how agencies support families with pets. I'm Candace Hinkle, the Assistant Director of the Center for Pet Family Wellbeing here at the University of Tennessee in Knoxville, and I'll be your host today. Before we get started, please introduce yourself in the chat with your name and organization. We will use that information to enter everyone into a random drawing for a $50 gift card, and we'll select one winner, and that person will be emailed later today with the great news. So go ahead and start introducing yourselves. And then during the presentation, we do ask that you please put your questions for our speakers in the Q&A. We'll have time at the end, and I will ask as many questions as time allows. All right, as you all are introducing yourselves, I would like to take just a couple of minutes to introduce you to today's speakers. I'm pleased to introduce Claire Schuch, Kaitlyn Andres. Claire is the Associate Director of Research here at the Center for Pet Family Wellbeing. She is a community-based researcher and educator whose work focuses on community health, health equity, qualitative research, and program evaluation. And then we have Kaitlyn with us. Kaitlyn is a research associate at the center as well, and her work uses qualitative research to better understand public health challenges and help advance healthier, more equitable outcomes for people and pets. Today, Claire and Kaitlyn will share findings from a national survey that they conducted of 209 U.S. social service agencies, including how agencies currently address clients, pets, barriers to pet inclusive services, opportunities for collaboration, and what agencies need to better support pet families through a whole family and One Health approach. So Claire and Kaitlyn, thank you so much for being here today, and I will turn it over to you.
Thanks for having us.
Thank you, Candace. I am so excited to see you all. I'm reading the chat over here, and it's great to see so many different organizations being represented, people from all around the country. I don't think I've seen any international folks, but it's very possible that there are some international folks on here as well. So thank you so much
for those of you that are just joining us, if you will introduce yourself in the chat with your name and organization, and we'll be entering everyone into a drawing for a $50 gift card that we'll announce later.
Okay, sorry about that. Can you see?
Yes.
Yeah, it looks good.
Okay, excellent. Thank you. So thanks again for everyone for being here. We are the Center for Pet Family Wellbeing. So for those of you who are not familiar, we are housed at the University of Tennessee, and we're an interdisciplinary initiative dedicated to strengthening the bond between people and their pets. And so we work to transform currently fragmented systems, veterinary systems and community social service systems into integrated One Health systems to improve access to care and support our pet families. We envision a future in which our communities collaborate to ensure that every pet family, regardless of their circumstances, has access to the services, resources, and care that they need to thrive. And so this project is very much along the lines of that. We are generously funded by Maddie's Fund, so want to thank them for all the work that they do in making our work possible. So for today, I'll briefly explain what you can expect. As Candace was saying, we're going to be reviewing the background and the results of a national study that we conducted with social service agency staff. And everyone who has registered will also receive the recording and the full report. The full report is going to be also available through this QR code and will be posted on our website in case you want to take a closer look later. And then we'll, at the end, cover some of the implications of this work, next steps of the work that we're doing and some other people in the country are doing, and then we'll leave some time for questions.
All right. Yeah, thanks, Claire. So I'm going to go through some of the backgrounds that helped us with the foundation of our study and then the methods for it. I don't know if I can control the slides, Claire. I think you might need to. Thanks. So I saw in the chat we have a lot of people with a pet and animal welfare background joining us. So a lot of this information is not going to be new to you, but this is the information that really helped us get started in this study. So currently, we estimate that about 70% of U.S. households have a pet, which most of them considering their pet a member of the family. We know that social service agencies in the United States provide really critical support and resources to families that have a need or experiencing a crisis. But often, a lot of the services that these agencies are providing are not pet inclusive, or they don't consider the role that pets play in a person's life. And so this really becomes a barrier to these organizations carrying out their mission and providing their services. As you can see highlighted in the gray boxes, this is an area that hasn't had a lot of research in it, so these numbers are a little bit broad, but we do have some estimates as far as and some insight into things like people living in a domestic violence situation and not leaving either out of concern for their pet or because they don't have anywhere to go with their pet where they can take them with them. We also see with food banks, clients with pets come in looking for human food to serve to their pets because they can't access pet food any other way. And right, that's not good for the pet. That's not good for the humans then that are missing out on the food that they needed. And then also, there's a lot of research into unhoused individuals and their experience with shelters, because a lot of them do not allow pets into the shelter. And so often people will choose to stay unsheltered with their pet as opposed to going to a shelter. And these are just a couple examples. We've also heard of people delaying medical care because they don't have anyone to care for their pet, not evacuating in a disaster situation because they don't have a shelter to go to with their pet. So all of these things become barriers to social service agencies being able to provide the really great resources that they have to people because the pet's not being accommodated. Next slide, please. So all of that background information helped us to put together some questions that were guiding our study. So we're really interested, looking across the country at social service agencies, how are they currently serving pets? To what extent are they addressing their clients' pets, and is it being done formally or informally? In order to carry out these services, collaboration between social service agencies and animal welfare organizations is really important. So what factors are impacting this collaboration for those that are or are not doing it? And then of the programs that already exist, which ones are most compatible with being pet inclusive or with a One Health approach? Recognizing that the health of pets and people is so interconnected, which of these programs is it going to be easiest to include pets into, and what factors makes that successful? And then finally, as we look towards, operationalizing this whole family approach to social services, what kind of evidence, guidance, resources do agencies need in order to do this successfully? What do they need to convince their leadership or to make their processes more pet inclusive? So these are the questions that guided our research. And on the next slide, this is kind of an overview of how we carried this out. So we started with 10 key informant interviews. Some of you might be here today. Shout out if you are. We sat down with 10 different social service agencies across the country and asked them a lot about their current services, whether or not they include pets, how they do, really got into a lot of detail and a lot of nuances about how social service agencies are operating so that we could build our survey to gather more broad data. So based on our conversations and what we've seen already in the literature, we created a 30-question survey mixed of open and closed-ended questions. Our audience was staff at social service agencies. So we really wanted to hear from the people providing these services. That could be anybody from, entry-level staff up to higher leadership. Really important that we did only take one response from each organization. We didn't want a large number of people from one organization kind of skewing the data. So that was open earlier this year, and we distributed this online through social media. We relied on professional networks, so social work networks, social service networks, people passing along the survey. And then also we really wanted to make sure we weren't just, sharing with people we knew. And so thanks to some help from some other researchers, we did direct outreach to a couple of the largest cities in each state and reached out to all the agencies in that city and sent them the survey either by phone or email. And so, yeah, like I said, we really just wanted to get this survey out and try to get as broad of a representation as possible. And so at this point, I'm going to pass it back to Claire, and she's going to tell you a little bit about what our respondents looked like.
Thanks, Kaitlyn. So our respondents came from across the country, representing 43 different states and Washington, D.C. Once we removed any duplicate responses or incomplete responses, we had a total of 209 organizations left, representing the different geographic regions and also different staff roles, including, like Kaitlyn was saying, case management, program directors, executive team, and among other would be some volunteers. These organizations were varied a lot in size. Some of them were very small, serving even less than 100 people for last fiscal year. And about half of them served at least 1,000 people in the last fiscal year. And most of them are operating in urban areas, but rural and suburban areas are also well represented. And we had about a third that served all of the geographic areas. That's why it's more than 100%. In terms of the types of programs and services that are offered by the organizations who responded, housing and homelessness services was the top one, followed by general community outreach and engagement programs, financial and transportation assistance, and then food nutrition assistance. So when we look at the sectors, we saw a big sector in housing and homelessness, domestic violence, and sexual assault services, but most of the organizations actually offered different service types. So we had about 21%, 22% only listed one service type. They were narrow in their focus, but as you see here, 69% of the respondents listed 3 or more service types. So a lot of these organizations, which if you work for a social service agency, you know this, you're doing a lot of different things. And so they were maybe doing one thing that they were really focusing on, but offering various types of services and assistance.
All right, so now we're going to look at some of the results from the survey. And starting really where we need to start is just, are you asking about pets and how many of the clients have pets? So of the organizations that responded, about 47% indicated that they do ask about pets at intake. At this point, I do want to highlight that one of the limitations of this study and really of a lot of the studies that we do, pet is in our organization's name. We were clear when we reached out about the study that we were interested in services related to pets. So some people that aren't doing any work related to pets thought that this was not relevant to them. We tried to make it as clear as possible. We wanted responses from everybody, but we might be overrepresenting here from agencies that are actually pet focused. Anyway, happy to see that almost half of the respondents are asking about pets at intake. There are different ways that your agencies are doing intake. It might be one single form for all of your services, might be individual programs. And that's something to consider when we think about asking about pets. Now, the graph on this slide, we asked the respondents to estimate the proportion of their clients that they believed had pets. You'll see the highest bar says that that's some, anywhere from 10 to 40%. But like we mentioned in the beginning, studies suggest that about 70% of households have pets. So there's a couple thoughts here. Maybe the populations being served by these agencies are less likely to have pets. But I think the biggest takeaway for us is that staff just don't realize how many of their clients do have pets. It's likely that it's higher than they realize and higher than they're estimating. And that's really important for us to be aware of as we move towards more pet inclusive services. Next slide, please. So this is really, this graph here is really one of the biggest pieces of information we were looking for in this study. What kind of pet-related assistance are agencies offering, and is it being done formally or informally? So there's a couple different types listed here. I'll call your attention to the fact that the dark blue bars are formal services. It's built into programming and policies versus informal. It's kind of staff doing kind of ad hoc work on their own. The most common, not surprising to us, is offering pet food and supplies. That's kind of an easy way to connect with people, of clients, an easy thing to have on hand to offer. Pretty much throughout this, the theme is that these services are going to be more commonly informally offered. And we'll talk a little bit about that, but you can see that right from the top. Helping financially, whether it's with pet deposits or veterinary assistance, that's also common from our agencies. And then there's some other things, helping with vaccines, spay and neuter, helping find temporary foster and boarding situations. These are all things that the agencies indicated doing. But you'll see in some cases, it's twice as likely that this is offered informally. And that's really important to pay attention to because while that's really important, and we really applaud these agencies for helping clients with pets in any way they can, a lot of times that's not sustainable. We heard stories from the interviews we did and from the open-ended questions in the survey that, our organization doesn't really do much, but, we have one coworker down the hall who's really plugged in. She's always got pet food in her office. She knows all the services, but what happens when she retires? Does that go away? Does somebody else pick up that slack? So informal services, while they're great, they are not always sustainable. So we want to keep that in mind as we look at that. On the next slide, we're going to look at the methods of formal and informal assistance. So when this is being offered formally, typically that means, like I just mentioned, it's written into your policies and procedures that you support people with pets. You have official partnerships with animal welfare agencies, which is really important. We heard from different agencies about, having like a formal referral system to, maybe a low-cost clinic or a local shelter that had resources. These are all formal partnerships that all of the staff are aware of. There's, clear operating procedures for how to handle pet needs. Also, a really common way that they're assisting people formally is by collecting data. If you don't know how many pets are out there or what their needs are, you're not going to know how to help them. So that's a really important piece there. And then looking for specific funding or grants that are pet related. And really happy to see some people are including it right in their mission statement. That's not really common. I know this is kind of maybe a new conversation in this space, but happy to see that some people are including it right into their strategic plan. And then in terms of the informal assistance, like I said, it's not, it's things that aren't going to surprise you. It's staff that, just keep donated pet food in their office, people making ad hoc referrals to groups that they're personally aware of, volunteers and staff just driving pets to appointments in their own cars on their own time. Again, these are all really, and again, the discretionary funds from staff or personal funds, these are all really great ways to help our clients with pets, but, not sustainable and not formal. And so we want to look at how we can formalize what's already being done. We talked a little bit about the importance of collaboration with animal welfare organizations. So we asked, have you ever partnered? Are you partnering? Are you interested? 40% have an ongoing partnership. So that's really exciting because that's really going to help. If there's an animal welfare organization down the street that's already helping people with their pet needs, you don't have to build the services right into your organization. Just having that partnership and that formal understanding that you can send your clients there when they have needs is helpful. And then this bar, no but interested, that's a tremendous potential. So there are 40% of or almost 40% of the organizations that responded are really interested in building this collaboration with an animal welfare organization. And so Claire mentioned our toolkit that we're going to be sending out at the beginning. There's some information in there, kind of all of these potential points and growth points that we're talking about, but really excited about the potential there for these organizations that are interested. The graph on the right is showing how those who do have a past or ongoing partnership have worked in the past. So not surprising that emergency or crisis coordination's at the top. Just last week, our friends at the National Animal Care and Control Association did a presentation about how they prepare for and coordinate emergency services. It's really common. The need is really clear to include pets in those services. When we think about natural disasters or things like that. So a lot of crisis coordination collaborates with animal welfare organizations. There's also referrals and cross-training. Again, that's really important. A lot of people that have not, worked in animal welfare might not know how to approach pet needs when they comes to them. And so that training and having a referral is really important. And then, with that collaboration, you get things like shared food distribution, joint community outreach events, data sharing, all really important points in a collaboration. So we're happy to see that that's been happening. And yeah, I was just going to say right at the end there, we have a quote from one of our survey participants saying that their partnership with the Animal Welfare Organization has been one of the best and most supportive relationships they've had. Now, on this next slide here, we are not naive. We know that those of you working in social services have a lot of barriers, a lot of constraints you're trying to work in. But we were happy to see that the barriers that have come up to collaboration were structural and logistical, and not because our respondents didn't think it was necessary. It wasn't a philosophical issue, but a structural issue. So we asked why they haven't collaborated in the past. Probably not going to surprise anybody. Limited staff and time capacity, lack of funding and resources, haven't identified potential partners yet. We know that these are going to be issues that you're all going to have to overcome. And then what are the barriers to moving forward with collaboration? And these are some things that we look at in our toolkit. We know that there are restrictions on where pets can go. We know that not all shelters are currently physically built to accommodate pets. We know that there are restrictions on what you can use your funding and your grants for, and that doesn't always include, being able to buy pet supplies or food. And along with those 2 points, there's the issues of insurance and liability concerns. We know that those aren't all things that your organization can address on its own. Some of them are broader, but they're definitely things that we can help with. And then, of course, again, the limited staff or volunteer capacity. We're not naive. We know that you all are already working overtime, but we're hoping that there are some easy ways that we can include pets in the work you're already doing. So we asked our organizations, what would help you offer pet-related assistance? And again, there are things that we address in our toolkit, and some of the things we know are bigger than just your organization. Most people said funding or grants for pet-related assistance. We know that's really common. You have to have the money to do the work. 67% of partnership with an animal organization, that's definitely something we can accomplish. And then with those points, access to pet supplies and resources, some people just don't know where to source those things. And then, some other common responses were regulatory guidance, model protocols and toolkits. We were going to provide you with that today. And that's, this is one of the reasons that that's a big deliverable that we wanted to take out of the survey was giving information right back to you to actually do the work that we're hoping we can do. Along with that goes training and education. And then looking here to my friends in the audience in research and program evaluation, we need data, right, to prove that this work is effective. And so looking for data, examples, case studies, the more that we can prove that these partnerships and these pet inclusive services are effective, the more people are going to do it. And on the slide, we just have some quotes, just to kind of give voice to some of those data points from respondents in the survey. Again, things that I just said. We need dedicated grants and financial support that's specific to pets. Of course, we need additional staffing to do that. Some things are beyond our capabilities, though, right? The housing market and who allows pets. There are folks out there doing that work on a broader scale, groups like the Pet Inclusive Housing Initiative. But we recognize that some of these constraints are outside the scope of what just one specific organization can address. We need stronger collaborations, clear policies are really helpful. And that's why, formalizing some of your practices can help with that. And then having an advocate that would work with clients and residents that have pets. Not sure if everybody's aware. I mean, I would imagine in this audience, there's a lot of awareness, but a lot of people don't know that veterinary social work is a field. And I think if more social service agencies maybe had a veterinary social worker on staff, it could help with a lot of the concerns. And, how do we approach people who have pets with needs? So that's definitely something to think about as well as when you look at your staffing needs. So then we also heard some issues related to leadership and organization mission, strategic plan. You'll see these percentages are a little bit lower. Again, we know that this issue is not philosophical. Most people are on board with this, but we asked, like, what kind of data and evidence do you need to convince your leadership? Most common was endorsement from funders, definitely. Cost benefit, return on investment. We need to know that we're investing the money in the right place. So again, these are all things to consider if you're in research or program evaluation. We need to demonstrate that these things are effective. And from what we've seen so far, we think they are, but this is definitely a new area and there's a lot of potential here to evaluate what we're doing. So at the end of the survey, we asked, is your organization ready? What do you need to be ready to include pets in your mission? Really excited to see that a lot of people are ready, 30% very ready, almost 30% somewhat ready. We still see some organizations that aren't ready at all, but we talked about some of the barriers today. And we recognize that this reality isn't for everybody, but we just want to move towards a direction where our systems as a whole are more inclusive. So excited to see that people are ready to do that. And then we asked a few very specific questions about future readiness. We're going to look at the green bars here. Dark green, strongly agree, light green is agree. But just green in general is good. So over 80% recognize the role that pets play in their clients' lives. Really happy to see that. We know that it's so important. Pets are so important to physical, social, emotional well-being, and they can have an impact on that. So glad that people are aware of that. People are also aware that animal welfare and social services are often operating in separate systems. And that's what we want to, kind of address with what we're doing here. There's an organization I was just looking at earlier, right on their front page. We believe animal welfare is human welfare, and helping pets helps the people too. So hopefully these human-focused social service agencies can start to understand that as well. Leadership supports collaboration. Happy to see that. And then, a little bit less agreement here about agencies' mission and values and having the resources available. But I think there's opportunity for growth there. And there's opportunity to, kind of understand this issue a little bit better. So like we said, one of our big takeaways here is that the issues are structural, not philosophical. People are ready to include pets in their mission. We just need the tools to do it. And so at this point, I'm going to pass back to Claire. She's going to talk a little bit about our findings here and where we're going with this.
Thanks so much, Kaitlyn. So as you can hear from our results, we know that pets are common among the clients of social service agencies. And thankfully, agencies are starting to recognize this. They're starting to recognize what it means to serve the whole family, but we still have a long way to go. We see that agencies are supporting clients with pets, most likely, most commonly by offering food or supplies. But again, this support is often informal. So to the extent that we can formalize this and make that part of our processes and procedures, the more sustainable it's going to be in the long run and the less dependent on the one or two people who do this out of the goodness of their heart and the connections that they happen to have in the community. As Kaitlyn pointed out, a limitation of this sample is that because we have pet in our name and we did disclose that this was related to Pet inclusive services, as much as we said this was also open to people who and agencies who aren't already serving pets, is probably overestimate of the number of agencies or percentage of agencies out there who have pets on their radar or offering some type of pet. So kind of keep that in mind. But even though that might be the case, the larger trends of the barriers are probably going to be the same across all social service agencies and unlikely to differ. So the fact that more support is needed in overcoming those barriers probably rings true for agencies outside of our sample as well. So what does it mean to get started in this area? One of the main things that other agencies have also advocated for is the ask if you have a pet. Just simply asking that question, not only does it open up the opportunity to connect with the person because they're talking about their pet, it's probably something that's bringing them joy. It also better helps understand the client needs, and if they're coming in for housing services, again, it's important to know if they have a pet or not. It's going to impact where they can go. If they're food insecure, their pet is probably also food insecure. And so just having that information, obviously needing to understand what to then do with that information, be able to act on it as well. As Kaitlyn was mentioning, developing these formal referrals and the partnerships is really important. So if it's just a list that you have of community organizations, we're not expecting every social service agency to now become fully pet inclusive, and every agency has veterinary care on staff and grooming and leashes and everything, but you really leverage your partnerships with this. So having people that you can refer them to that offer these types of services, again, whether it's low cost veterinary care, whether it's for pet food or supplies or other types of needs, knowing what's out there and that you can consistently give the same referrals for every single client. Transitioning to standardized protocols. So again, this is kind of aligned with the formalization of this. And so every person who's on staff knows that this is the procedure and this is the process that we use when someone comes in and they have a pet related need. In some cases, there are lower barrier entry points. So maybe you can't have a veterinary social worker or a veterinarian on staff all the time, but something like food or supplies could be more feasible depending on the space and the resources that you have. And including this in student and staff training. So some of you are specifically working on training new staff or training students. So if you are working in social work or in public health, bringing this to the awareness of your students can really make a difference. And as students are starting to realize this, they are the new professionals who are coming into the workforce. And then they already have a One Health or One Welfare or whole family understanding. It's going to facilitate this process a lot for the whole field to kind of shift more into that human animal welfare direction. And then again, like Kaitlyn was saying, if you are if you are able to assist with building an evidence base and sharing case studies, sharing client testimonials where this has worked, that is really going to help other agencies as well, whether they're making the case to their leadership or making the case to their funders that this is important to pay attention to, and there's benefits that we can reap, both human and pet related benefits. So these are some areas that you can get started. Obviously, there are also some of the larger systemic issues that Kaitlyn also mentioned, and one of them is pet related housing. So if our housing isn't pet friendly or pet inclusive, then that's a major barrier. So we have partners who are working specifically on that, super important. And that's going to help social service agencies down the line as well. And then other area being if you're a funder, if you are funding social services, making sure that you're also allowing some of those funds to be used for maybe pet services, um, or having discretionary funds available, or if you're a funder in the animal welfare space, having small grants for social service agencies. So again, try to think more broadly. If funders can start thinking like this and make those opportunities available, then social service agencies and animal welfare organizations will have the financial support in order to fully enact these things. We want to shout out to some of the other people doing this work already, who are actively on the ground involved. Some of them are doing this work in communities across the country, and others are specialized in a particular city or a particular region. This is not an fully exhaustive list, but Open Door Veterinary Collective has a Ask About the Pets initiative, and we're working with them on building a toolkit. But don't forget the pets, which is also a great initiative between Red Rover and Greater Good Charities, has a whole list of sample intake forms and MOUs. They have a construction arm called Rescue Rebuild, and they will go in and help physically reconstruct shelters to make sure that co-housing is possible so people can be there with their pets. Bestie B&B, a great organization that assists organizations and families get temporary care when they need it for their pet if they can't do some type of co-housing, or they may need medical attention, or any type of situation where there's the need for temporary care for your pets. You have organizations like Care for Paws working in Central California, Seattle Food Bank, Rough Haven in Salt Lake City, Utah. All these great organizations who really get this work and are great models to look at if you're looking to put this into practice. And as we alluded to, we have our full report that is going live today, but then we are also working on a toolkit. It's going to be combining some resources of existing toolkits that are out there, but there'll also be different sections. So if you're particularly working in food, how do you do food, pet food, as well as human food, for instance? If you're working in domestic violence services, what does that look like, and how do you become more pet inclusive? There'll be policy guidance and different protocols in there that you can take a look at. If you are more interested in the One Health model, what does it look like to provide health care for humans and their pets side by side? Disaster response, another area. So there'll be an opportunity to take a look at that later this year, and definitely stay in touch and let us know if you are interested in seeing the results from that. But that will also be posted on our website, and that's going to be in collaboration with Open Door Veterinary Collective. So before I open it up for questions, I just wanted to mention that a lot of our work in the conversations that we have on this topic and other related topics happen on the One Health Community Forum. So if you are not part yet, we would love for you to join and either jump into existing conversations, or if you have your own question about how to become more pet inclusive or anything else really related to pet family well-being, we have a great network of people who are on there who will jump in and who are able to give you resources and answers. Okay, so without further ado, I will see if there are questions. Again, the recording will be available, and we'll have the slides on there and everything if you want to take another look.
Thank you, Claire and Kaitlyn. Just as a reminder for those of you who join us, if you have any additional questions, please feel free to put those in the Q&A. A couple of ones that I would like to bring up. Whenever doing the survey, was there any differences that you noticed between services for cats and dogs? Or is that an area that you asked about or looked into?
Yeah, thanks for the question. We did not really ask any questions about how services were specific to pets, so we didn't really see any of that come up. I mean, based in our other work, we've seen that there are some similar needs, right, in terms of needing vaccinations, spay, neuter, pet food. That really doesn't differ much between cats and dogs, but no, I wouldn't say that we really have any data on dog versus cat specific services that agencies are providing.
All right. And you talked a little bit about the different types of social service agencies that were researched, but how did you go about choosing or identifying which social service agencies to include in your research project?
So it was a very broad list. We looked at really any type of social service agency in all of the top three um, areas in every single state. There are a lot of agencies that got a message from us, and we try to be as broad as possible. So obviously, we still have a convenience sample in that those who decide to respond, maybe pets were already on their mind, but yeah, we try to be as broad as possible, anywhere from Salvation Armies who might have, a huge national network to very, very small social service organizations that work in a particular locality.
Okay, and a follow-up to that is there any chance or do you have the data for specific states? So if someone wanted to look at data just for the area they serve, is that something that's available?
It is, and we're happy to talk about that if you work in a particular state. But the issue is only 43 states were represented, and then once you start breaking it down by state, the sample size gets a lot smaller. So I wouldn't say necessarily that the 2 to 5 state organizations in that particular state are representative of the entire state. I would say it's better to look at the organizations as a whole to understand these trends, but there might be state level policies or trends that are worth looking into. So if someone has a particular question about what the data showed for their state, we're happy to take a look at that.
Okay, great. Thank you. And a really great question is how can people or organizations collaborate with you all on research? How can they
Yeah,
contact you? If you don't mind to also put your email in the chat as well so people can
yeah,
reach out.
that's a great question. We will put our emails in the chat. We on our website, of course, we share reports that come out from our research. You can get in touch with us. Claire just put our research email in there. And then also we share a lot of our work on that One Health community. So, shout out to that, join that. It's not just us. There's groups there that are always sharing their research and their work. So yeah, join us on the website, email us, join us on the One Health community, all those ways to keep in touch. We're on LinkedIn, we're on Facebook. Um, yeah, look for us anywhere.
Yes, definitely reach out. We'd love to hear from people, again, how you're able to use this work. Since we are not a social service agency, we don't provide direct services. If that's an area you're interested, we are more than happy to direct you to someone else that we are aware of doing this, who can support you in that capacity.
Oh, this is a good question and one that I know that we've talked about just within our group. Do you have any data available about pet food pantry distribution restrictions?
Yeah, it's a good question. And you're right, Candace, something that we've talked about. Yeah, we know that that's something that people run into. There are different requirements in how human food and pet food are handled when they're in the same space. Um, We touch on that a little bit in our toolkit that's going to be coming out eventually, but also one of the reasons that we wanted to highlight others who are doing this work is because they clearly have already addressed that. If they already have a food bank that is incorporating both human and pet food in the same space. So yeah, I would say right now, the answer is, look to others that have accomplished that already. But that's something that we're kind of exploring to see how we can help people work through those constraints.
And then just a clarifying question about if is it the report that's going to be posted today and then the toolkit will follow up later?
Yeah, I
Yes.
definitely misspoke at some point and said that the toolkit was being shared today. The toolkit is not being shared today. We have our data report ready, which, like we alluded to, can be very useful in the conversations about, getting people on board. But the toolkit will be coming in the near future, but it's the data report from the study that we have ready today.
Okay. The next question is, sorry, I'm reading through the thing. Do you have any thoughts on how to encourage data sharing and human and pet collaboration more? And I hope I read
That's
that
yeah,
correct.
yeah, yeah. Yeah, thanks. I mean, that's definitely a great question. I think is still we haven't had a whole lot of insight into yet. This happened a little less, the data sharing happened a little less frequently than some of the other types of partnerships. Um, and I can't think of the top of my head of a specific example where this came up, but I do think that's an area where we could maybe look a little bit more into and how data are being shared on between different organizations. But if anyone is doing this already who's online, then feel free um, to put that in the chat as well.
And we'll also follow up with this on our One Health forum so that we can continue the conversation and everyone can share what their organization is doing or the programs that you're building. I know there's been a lot of communication in the chat about how your organization is adding new programs, and I think it'll be great to be able to continue those discussions. Claire, to go along with that last question of data sharing is, what kind of data, if any, are the social service agencies who are serving pets collecting? Or is there really kind of a deficit in the data around pets, even if they are asking those questions that's really been collected and looked at?
Yeah, thanks for that question. So we didn't actually ask what data they were collecting. We just asked if they were collecting it or not. And in most cases, they're not. Um, but I'm curious if anyone else is collecting that. If they're collecting pet data, what are they asking? I I can imagine that they would ask about species and maybe breed, but it does sound, yeah, it does sound like a good follow-up to kind of ask what um, what is being asked and then how that information is being used.
Right. And that's a really important starting point because I think back to some of the key informant interviews that I did. I spoke with an organization that probably provides every program type on that list that we showed. And they said, we would love to ask about pets. We don't even really know where to start. What should we be asking at intake? And so that, is really like that's the starting point. I know that there are some I remember seeing on the Don't Forget the Pet site from Red Rover. They have some sample intake forms that I remember seeing that I thought were useful. So I say this all the time. You don't have to reinvent the wheel. Somebody's already figured out what questions we need to ask people with pets. And so that's something we're planning on including in the toolkit too, some guidance on how to start, like what we need to ask at intake to be successful.
But yeah, in terms of the research that is out there right now, and this is why we wanted to do the study too, is to really start this conversation and start like thinking about what is out there and where things are missing. Because there's a lot of information about and data supporting why this is needed. And then there's organizations who are doing it, but then the gap is, figuring out, okay, how to do this, how to evaluate this, really looking more broadly at what are the best practices. There's still a lot of room there. So join us in the task of filling those gaps.
Right. And Danielle just shared in the chat the link to those forms and their document library for anybody who's interested in looking at those. Okay, well, that is all of the questions we have for now. As I said, please feel free to join us on the Well and Health community so that we can continue the conversation. And I want to thank Kaitlyn and Claire for being with us today and sharing their research. If you have not already, please remember to put in the chat your name and organization. We will use that for a gift card drawing of $50 that will be announced later today. And then after the webinar, you will receive a copy of the webinar as well as that full report that was mentioned. We hope today's webinar gave you a better understanding of pet-inclusive social service delivery and ideas for recognizing pets as part of the family in service planning and delivery. Thank you all so much for joining us today and being a part of the Center for Pet Family Wellbeing's One Health community. We hope that you'll continue the conversation with us and join us for future webinars as well. And always, we hope that you all have a great afternoon.